Hello, good afternoon. My name is Dr. Chudi Explains, and today it's a good day. Today is our open clinic in YouTube with Dr. Chudi. And today we'll talk about how you can become pregnant if you have polycystic ovarian syndrome, which you also called PCOS. So if you're currently diagnosed of polycystic ovarian syndrome, which I'm going to explain, what I'm going to take us through today are steps you can take to still succeed in becoming pregnant. So the fact you have PCOS, it's not the final. You can still succeed in becoming pregnant, but there are things you have to be conversant with, things you must take good care of. So please, when you join, announce your name, announce your location. I'm going to start very soon. When I'm done with my presentation, you will have opportunity to ask your questions. Immediately after this clinic, I will repeat this same clinic in Facebook. So join us in our Facebook community page, our Facebook main page, my private timeline, and our group. We are talking about polycystic ovarian syndrome. Very important. And we have a full house. Onyi, welcome. Mahaneli, COO, Dr. Ndichie, Teresa. I want everybody in this clinic to indicate. It's very important. Polycystic ovarian syndrome is a condition that so many women are currently suffering from. And so many are actually wondering if they are able to become pregnant. The answer is yes. So I'm going to start. When you have polycystic ovarian syndrome, there are three things we are worried about. Polycystic ovarian syndrome is one of the most common causes of infertility. Remember the definition of infertility: inability to become pregnant and have your baby for a period of 12 months if you're below 35. Inability to achieve pregnancy if you're 35 years and above for a period of 6 months. So if you're currently with your partner and you're below 35 and you guys are doing the right things, making love without protection, not using contraceptives, then at the end of the 12th month, if you are not pregnant, you have infertility. If you're above 35, at the end of 6 months, if you're not pregnant, you have infertility. Now, polycystic ovarian syndrome is a known cause of infertility in so many women. In America, there's a particular body interested and, that organizes everything about disease and control. It's called CDC. They reckon that as of this moment, about 5 million women are currently in America living with polycystic ovarian syndrome. So it's most times misdiagnosed, misunderstood, and some women might have this condition without knowing. Now, what's the good news? With the modern technologies we have today, we can still help every woman to become pregnant. So in as much as you have this condition, there are things we can do for you so you can become pregnant. Many women with polycystic ovarian syndrome are currently worried, oh, can I ever be a mother like other women? The fact remains you can. Now, there are three things I want you to look out for in polycystic ovarian syndrome. Three things that actually are the problems. Number one, you have irregular or no period. The biggest concern in women that have polycystic ovarian syndrome is the ovaries. So they will normally experience lack of period, which we call amenorrhea, or irregular period. That's number one. Now, what leads to this irregular period or lack of period is the increase in level of androgens. Androgens are male-dominated hormones. Men are supposed to have more androgens compared to women. Like I'm a man, I'm supposed to have more testosterone. So testosterone is a type of androgens. So at the center of polycystic ovarian syndrome, it's increase in production of these androgens. So women that have polycystic ovarian syndrome will have elevated level of testosterone. When you have this elevated level of testosterone, some women can manifest with growing body hairs, especially facial hairs. I have hairs in my face because I'm a man. I have a lot of testosterone. As a woman, you should have testosterone, but it should be limited. When you have more, you will express as if you're a man. So men that have hairs are expected, women that have hairs in their faces might have polycystic ovarian syndrome. That condition is called hirsutism. So this is an expression in women. Now, women might also notice extensive acne and pimple all over their faces. That's also a presentation of polycystic ovarian syndrome. Now, the second one is appearance of polycystic ovaries. So if you notice, this is a cut section of the ovaries. When you go to women that have polycystic ovaries, will have many polycystic ovaries, many cysts inside the ovaries. So these are the criteria. These are the 3 diagnostic criteria for any gynecologist to diagnose a woman with polycystic ovarian syndrome. For us to make this diagnosis, we have to have at least 2. So number 1, the woman will be experiencing no period. Number 2, when we draw the blood, we will notice an increase in testosterone level and other androgens. Number 3, we'll also notice that if we take a cross section of the ovaries, the appearance in the ovaries are not necessarily excessive growth of the cyst. Polycystic ovaries you're seeing there are accumulated egg follicles. So when the testosterone comes, they will stop the ovaries from ovulating. You have eggs, but you can develop the follicles. So over time, the follicles will start accumulating. The follicles will start accumulating, and the woman will not ovulate. So lack of ovulation is the reason why you have those polycystic ovaries. Because if you have this, you begin to have menstrual irregularities. When you have menstrual irregularities, your hormones are going to be all over the place. When you can't ovulate, you can't become pregnant. So these are the specific knowledge you need about polycystic ovarian syndrome. Now, let's talk about what you can do to become pregnant. Now, because we have noticed what's causing the problem, the woman have higher level of